Good afternoon, everybody. This is Congressman Mike Levin, and I want to thank you for tuning in to our latest town hall on the coronavirus. And I'm very grateful for your spending part of your afternoon with us, whether you're on Twitter or Facebook or YouTube. We're glad you're here. And we've got a great guest this week, Dr. Kelly Motodell of the Vista Community Clinic, Chief Medical Officer. Thank you so much for being with us. Prior to joining the Vista Community Clinic in 2002, Dr. Motodell was a clinical instructor at Central California Faculty Medical Group and the pediatric chief resident at UCSF in Fresno. In addition to being the chief medical officer, she's also a practicing pediatrician at VCC. And I certainly can relate. We were talking before, she has a 6-year-old and an 8-year-old. I have a 6-year-old and a 7-year-old. So we definitely have some common ground. Thanks again for joining us today.
Thank you for having me, Congressman.
Well, as always, the number one thing that we can do in this very difficult time for our country, for our district, and our community is to follow the recommendations from the Centers for Disease Control and Prevention, the state of California, as well as the counties of San Diego and the county of Orange. And we're very, very grateful for the leadership that we have in our local community. Day in and day out, so many people are acting with kindness and generosity and in a sense of service. Today, National Nurses Day, we're very grateful to all the nurses that are out there in the front lines of this, truly heroes in our community. And just a couple of days ago, in fact, yesterday, I think, was National Teachers Day. So really recognizing our heroes, our teachers, our nurses, and so many others on the front lines that really make our economy work and allow us to continue during a very difficult time. Our country has, as you probably know, passed the 70,000 mark. With regard to deaths from COVID-19. It's truly a tragedy that has impacted so many families, including many of our families here in the district and in our respective counties. We now have over 1.2 million, in fact, 1,219,952 cases of COVID in the United States. It's by far the most of any country, and 72,617 deaths. California has confirmed 58,920 cases, so rapidly approaching 60,000 COVID cases, 2,386 deaths. In San Diego County, 4,160 cases with 150 deaths. Orange County, 2,873 cases and 61 deaths. And as we've said time and again, more than statistics, these are brothers and sisters, sons and daughters, fathers, mothers, and husbands and wives, and it's just an extraordinarily difficult time for so many in our community, as well as for our economy. We now know that over 30 million Americans have filed for unemployment insurance over the last 6 weeks. So we really have two huge challenges that are facing our country. We have an economic crisis, and really to deal with that economic crisis in the long run, we've got to deal with the public health crisis. That's how we'll be able to really get our economy back moving again. And you can't have a healthy economy without healthy people. So in Congress, we've done a number of things. We've now passed 4 bipartisan bills since the beginning of March. First, March 6th, we passed an $8 billion supplemental appropriation for vaccines and also for PPE, personal protective equipment, for our frontline medical professionals. Turned out not to be nearly enough. We realized in the middle of March we needed to do far more. So we passed another $200 billion for what was called the Families First bill. And that was largely focused on paid sick leave, paid emergency leave, along with additional funding for SNAP, for nutrition assistance, and additional funds for Medicaid. Then we realized that wasn't nearly enough. So then at the end of March, we passed the CARES Act. You might have heard of that. It's a $2.2 trillion bill designed to help both our public health needs as well as our economic crisis. On the public health side, $100 billion for our hospitals, not enough for our community clinics. We'll get to that, I'm sure, in a second. $150 billion for our state and city and county governments, although not nearly enough, and more is needed there. Roughly $20 billion for veterans, $16 billion for our strategic national stockpile, again for PPE, and then $31 billion for our schools, for our K through 12 and our higher education institutions, of which about $44 million came to our higher ed institutions in the 49th district, to UC San Diego, Miracosta, and Saddleback College. In addition to all of that, it had three major components for our economy and for our families and for our workers. One was expanded unemployment insurance, so an additional $600 a week in unemployment insurance for up to 4 months, bringing the average, or not the average, but the maximum unemployment insurance benefit in the state of California from $1,800 a month to $4,200 a month. In addition, expanding the unemployment insurance to gig economy workers and to 1099 independent contractors, creating a new pandemic unemployment assistance fund. That's now up and running and operational, and we're very hopeful that many in our community are able to utilize that program as they try to get through this very, very difficult time. Second, direct cash payments of up to $1,200 for those making $75,000 a year or less, and $500 per dependent. Those payments largely have gone out, but the IRS has a portal. If our viewers are interested, they can go to our website, mikelevin.house.gov. We've created a COVID-19 resource guide, which includes the links to the IRS portal and virtually every other website that you might need to navigate all those federal programs. And then finally, and to a certain degree, most controversially, the Paycheck Protection Program. Initially $350 billion intended for our small businesses. There was a lot of controversy that certain small businesses that really we don't think of as small businesses, like the LA Lakers basketball team, Shake Shack and Potbelly Sandwiches, Bruce Chris Steakhouse received some of that money. Lots of public companies receiving some of that money. Clearly, we did not intend for larger businesses to get those funds. We then, in the second tranche under the PPP, we made sure that there were guardrails, that there was a lot more for smaller and for medium-sized businesses, the true mom and pop businesses that really need those funds. And in addition to that, with interim legislation that we passed just a couple of weeks ago, $484 billion, $320 billion to the Paycheck Protection Program, as I mentioned, 60 of that directly to small businesses and small lenders, specifically small lenders. And then $100 billion in additional healthcare funding, $75 billion for hospitals, and $25 billion for testing, including the requirement that the administration develop a national testing strategy for both the standard tests and for the antibody tests. They have to report back to Congress by May 24th, and we're going to hold them to that to make sure that they actually have a testing strategy that's commensurate with the needs and the science. And what we've heard time and again from the scientific community is that we need 152 tests per 100,000 people per day. That means in the state of California, we need around 60,000 tests a day. And in a place like San Diego County or Orange County, around 5,000 tests per day. I was just on a Zoom conference earlier today with Mayor Faulkner in the city of San Diego and Supervisor Bartlett from Orange County. And both counties, I think, are working hard towards achieving those goals. But we need to do what we can at the federal level to help support the good work being done at the county and at the city level. In addition, one of the things we have to do, and one of the reasons I'm really excited to have Dr. Modadel here today, being from our largest community clinic in the 49th district, is that community health centers and other Medicaid providers really did not receive their fair share of funding in CARES 1, and we've really got to correct that in CARES 2. They provide care for some of our most vulnerable neighbors, including those who are low income, uninsured, or homeless, and it's critically important that they're able to continue their work. Many large healthcare providers receive federal aid. The first tranche of that funding was allocated by HHS based on providers' Medicare population, meaning that, again, community health centers like Vista Community Clinic with lower Medicare volumes did not receive the support that they needed. Without the funding they needed to cover unreimbursed healthcare-related expenses or lost revenues attributable to COVID-19, they could be forced to close. And so obviously we want to address this. I led a letter to HHS Secretary Azar to highlight the need for more community health center funding. More than 70 of my House colleagues signed on to support that letter. And in just a moment, I'll turn it over to Dr. Modadel to explain more about why this relief is so desperately important. We also need more help for our state and local governments. We need more for SNAP benefits, nutrition assistance. We need funding for the United States Postal Service, which is on the brink of insolvency. And we need national vote by mail, which is something that I supported before COVID-19 and something that I think is all more important now, particularly after what we saw in Wisconsin. Nobody should have to choose between their health and the ability to vote in the United States of America. Just very briefly, I've championed a few other things. The COVID-19 Graduate Relief Act, which would provide relief for college students graduating this year, helping them with their student loan indebtedness over the next 3 years. Additional funding for education, and specifically for things like distance learning technology, Wi-Fi hotspots for those who don't have adequate internet. Obviously, if you don't have adequate internet, you can't study from home, you can't work from home, you can't communicate from home. And it's so vitally important that we bridge the digital divide that still exists. Roughly 21.3 million Americans still don't have access to broadband in the home. I also led an effort with my friend, Republican Rodney Davis of Illinois. We're trying to get our Prevent Family Fire Act as part of CARES 2. That's a bill that provides a tax credit for safe storage devices for firearms. And we know with young people and children at home that gun-related accidents drop significantly if firearms are locked. In fact, the estimates I've seen are 74% fewer accidents if firearms are locked. And so our bill, we hope, can make it into CARES 2. I also led a letter to FEMA with 56 of my House colleagues demanding greater transparency from them, following reports that PPE and other important equipment was being diverted with very little transparency, very little accountability. We've got to get to the bottom of that. And I'm very pleased that President Trump signed into law our Student Veteran Coronavirus Response Act, which ensures student veterans won't see a reduction in their monthly housing allowance or other benefits as a result of their schools moving online or being forced to close as a result of COVID-19. Very important to me, chairing the Veterans Employment Subcommittee with jurisdiction over veterans employment, that we got that done. And finally, I've been very saddened to hear of the increased incidence of domestic violence during COVID-19. So I'd encourage anybody that is watching this that's in need of help, or if you know others that are in need of help, you can call or text the National Domestic Violence Hotline at 1-800-799-SAFE. Again, that's 1-800-799-SAFE. And again, as I said before, I'd encourage all of you to visit our website, mikelevin.house.gov, where you can see our COVID-19 resource guide. And it has just a ton of information about all those federal programs that I mentioned. So with that, I will turn it over to Dr. Kelly Modadel. Thank you again for joining us, Doctor.
Thank you. Thank you. Yeah, so Congressman Levin already told you a little bit about me. So let me tell you a little bit about community health centers and Vista Community Clinic. Vista Community Clinic is close to 50 years old at this point that we've been in the community. And although we started in Vista, California, we now have 8 clinical facilities spread throughout 3 counties, including Orange County, Riverside County, and San Diego County. Last year we cared for over 70,000 patients. That the number of deaths, when Congressman said it, kind of hit me, because it would be like wiping out our whole patient population of Vista Community Clinic. So we care for 70,000 patients annually for over 250,000 visits. And community health centers, we're just one of many community health centers, but San Diego County in particular relies heavily for the care of we're the safety net for the healthcare in San Diego. But throughout California, community health centers care for 1 in 6 Californians. So that's quite a big percentage of the care being provided. They take care of 1/3 of the state's Medicaid population. And that includes 500,000 migrant workers and 250,000 people experiencing homelessness as well. So our role in this pandemic is pretty critical for helping patients not only stay healthy for other reasons, in addition to the COVID, but also to keep them out of the emergency rooms if they are experiencing respiratory symptoms they believe are related to COVID. So, I talk to my staff time and time again. Really what we are focused on is keeping people in their homes and healthy. And when we can't do that, we have the option to bring them in if necessary. And if necessary, we will send them. But we are able to be that triage line for them to know, is this something that really needs a face-to-face visit or not? Is this something that really needs to go to the emergency room or not? And with that, we can collaborate with the hospitals to help keep their census focused on the patients who really need to be there. We have switched to a lot of telehealth. So community health centers up until this point had not really been authorized to do telehealth visits at all. So, some of the larger healthcare organizations definitely were doing some telehealth, although not a whole lot. And anybody who's had any interaction with the medical community during this pandemic knows telehealth is a big part of what we do now. So we switched to probably close to 85% of our visits now being exclusively through telephone or video contact. And at the same time, we've had this steep learning curve for that. We are still having people come in for those visits that are necessary to come in for. Despite this, we have found that many of our patients are not seeking the medical care that they need. We've seen a 30 to 40% reduction in our visits. And this is where that financial aspect that Congressman Levin was talking about has really hit home for us. We're a nonprofit, so we run on small margins. And switching to telehealth was costly, and now seeing a drop in our visits is also costly for us. We're seeing people delay their vaccinations. American Academy of Pediatrics has said children, especially those 2 years and under, still need their vaccinations. So if you have children in that age, I encourage you to reach out to your pediatrician and find out how your child can safely get their immunizations, because most every pediatrician I know has found a way to make that happen. We are seeing that people are delaying their chronic care needs. So vaccinations being a preventive care issue, but also what about those diabetics and hypertensives that need to make sure they're staying in good control, make sure they are still getting education that they need. Community health centers are there to do that. And we are ready and wanting to do that because we want to keep everybody healthy through this pandemic as best we can. Congressman Levin talked a little bit about the funding, and we had some, we missed out on some of that early on, but he's really been battling hard for us there in Congress, and we're so thankful and did receive some funds. But even the funds that we got really are covering about, maybe a month's worth of our losses. And as you know, we've already been in this for 2 months. So we're grateful that he's continuing to fight for our needs there to get us additional funding so that we can continue to take care of the community. We are concerned about what's going to happen after this as well. So those are the things we're doing now. But what's happening as we start to open things back up? What will healthcare look like? Well, I don't think anybody has the answer. This is a first for all of us. But some of the things that we are worried about is now we know there's a lot more uninsured patients in the community. And that's been a focus of community health centers all along, is for those that can't find care elsewhere. We want to be there for them. With this increase, will we have the capacity? Will we have the doctors and nurses and staff needed to take care of this increased volume? We are also concerned about those folks I talked about who have put off some of their primary care needs, their chronic conditions, their preventive care needs, all the mammograms that have been missed, all the colonoscopies that have been missed, all the pap smears that have been missed. We've got to get on those because we know the reason we do those is to pick up early disease. And so some of that disease won't be as early as it would have been otherwise had people been able to see their doctors face to face. We are also concerned about the behavioral health needs of our patients and of the community. So most community health centers have a behavioral health department, and we have kept ours busy through this, but we know that this is an anxiety producing first of its kind event for a lot of people. So even those who have not had an experience of needing behavioral health services in the past, we want to make sure they know that we are available to them as well. And we need to make sure that we can be, and we have access to be. Behavioral health was already a little bit of difficulty with access prior to this. It was going to be even more important that we're able to get qualified therapists and psychiatrists into the community health centers to take care of those folks that need it. We are first and foremost seeing our role, as I said, to take care of the community and keep folks out of the emergency room. We don't have a playbook for this. We've been doing it as we go along. We're working with each other across different counties and across the country, seeing what best practices there have been, and I think we're learning a lot. And we're hopeful that at least a silver lining of all of this is that we will be able to do telehealth into the future as well. And I'm hoping that, for today, I can help answer some of the questions folks have and supplement the great information that Congressman Levin is going to be giving to you and keep everyone healthy.
Well, thank you so much, Doctor, for all the work that you do and for your entire team there at Vista Community Clinic and all of our frontline medical professionals. We're just truly grateful. So many really sacrificing, in some cases with this disease, their own health, their own safety, to be out there helping others and serving others. So we're truly, truly grateful. to you all. And we've got a ton of your questions. We'll get to as many of them as we can. We'll start with a question for the doctor from Craig in Dana Point. Craig asks, are you aware of any scientific data that supports the claim by the state of California that airborne transmission in open outdoor environments like state parks, beaches, and other recreation areas presents a significant risk, and that this risk far outweighs the physical and emotional costs of closing these spaces? And I'll weigh in on this too, but we can hear from you first, Doctor.
Sure, thank you. Thank you for your question, Craig. So unfortunately, we don't know for sure whether this virus has an airborne spread or not. There's still a lot of research being done about that, but for now we know that it is droplet spread. We know that it is fecal oral spread. And so those are certainly ways that we can be protecting ourselves. I think the risk with the beaches, you are right. If there was just a few people on the beach and they were staying 6 feet apart and they weren't, interacting with each other, the beach might be a wonderful place and a safe place to be. The problem is not everybody is doing those non-pharmaceutical interventions or NPIs that are necessary to keep places like beaches and parks safe. So if we could open them and keep people 6 feet apart and have people wearing masks, then that is certainly a direction we could go, because we know the risk with spreading the infection is certain death for some people, and we don't know which people those will be. And while there are risks for emotional health as well, we need to make sure we're balancing those. But it is my understanding some of the beaches will be opening up or have been opening up with some of those guidelines in place. I just can't stress enough how important it is to follow those recommendations of your public health officer and your city's leadership to make sure that those beaches stay a safe place to be, so we can continue to move forward.
I think you said it well, and I've been encouraged that in our local communities that the state and the cities have worked together in a collaborative fashion to try to address whatever issues. And I think what happened, particularly in Orange County a couple weeks ago and last week, is is the only county that had the beaches open. You had everybody from everywhere congregating in our beaches, and that created a tough situation where people were not always 6 feet apart, difficult to kind of monitor that. And so, I'm hopeful though that with the understanding and the compromise moving forward, that we'll be able to enjoy those public spaces in a way that still adheres to the public health guidance. That's really, I think, the key, is that we maintain that social distancing. Ken asks, what is the House doing to make sure that the U.S. Postal Service is supported and remains as an American institution? What can be done to keep the post office solvent? That is a great question, Ken. I'm going to do everything I can to help keep the Postal Service solvent. It's vitally important that we do so. And as I mentioned before, I chair the Veterans Affairs Subcommittee that deals with employment. And we've got over 100,000 of our veterans that are employed at the U.S. Postal Service. So I'm looking at it through that lens and thinking of the unemployment rate among the veteran community that we've been doing a really good job getting that down to 3.5% to 4%. And, I anticipate that, like the unemployment rate generally, that's going to spike. So I see the real need there. And the Postal Service was in pretty dire straits financially before all of this. And by some accounts was set to, run into real solvency issues by 2021. With COVID-19, they've lost an additional $13 billion and counting in revenue, and we have to step in. And I think it's critically important that we do so. And I'm a strong advocate, as are I think many of my colleagues. Carolyn asks, why are we losing the guidelines while the numbers in this area are still increasing? So I'll let you answer that one first.
Sure. So as much as we want to keep people inside and in their bubbles and safe forever, we know that we can't do that forever. And we do need to look at safe ways to open things back up. We need to be sensitive to the financial and social impact the restrictions are having on everyone as well. So the state and the counties and the cities are looking for ways for a transition to help open up some areas that may be safer places to open up, that may be more vital places to open up. Even though numbers are rising, they are rising at a lower rate. So yes, that death rate and the caseload rate that Congressman Levin said earlier, those numbers are still going up, but they're going up at a slower pace, which tells us what we've been doing is working. And now we can see if we can do a little bit more opening up and have that still working. There are 5 criteria that the CDC has outlined that counties and cities should be checking off before they make that move to open things back up. I can tell you for San Diego County, they've hit 4 of those 5 criteria. So they've seen a downward trajectory in the percent of positive patients. The hospitals are functioning normally and not using a crisis care model to triage patients and to treat a surge of patients. There's been a 2-week downward trajectory in the number of people that are sick with flu-like or respiratory symptoms. And there's been a 2-week downward trajectory in the number of people who are sick with the COVID symptoms. But what we are still lacking is the testing. And I know we have some other questions coming up about that, but we need a robust testing process in place before we can really start to open things up more fully.
And I think you said it well, Doctor. Governor Newsom has made it pretty clear that testing in California still is not where it needs to be. And it's really the case in most of the United States. There's only a few states. If you use that Harvard metric that we talked about before, the 152 tests per 100,000 population per day, California needs to be at around 60 to 80,000 tests. According to Governor Newsom, we're at around 20,000. San Diego County, we're at around 2,500 to 3,000 per day. Orange County, somewhere around 2,000 per day. Everybody knows this is a big issue. There are a lot of reasons for it, but I think at the end of the day, I've offered whatever federal support we can. And again, I have tried to pressure the administration to do what we required that they do in the last interim bill, which is to produce a national testing strategy by May 24th. That would outline the specific plan to get from where we are today to where we need to be for both standard diagnostic testing and antibody testing. And we know there are issues in the supply chain, as one example, with things like swabs and with reagents not being readily available for purchase from state, county, and city government, where the federal government, due to the international nature of procurement, might need to play a more proactive role. So we're going to stay on it. We're going to stay proactive and aggressive to try to use whatever federal resources we've got. And it's certainly not for lack of sending money to the relevant agencies. We've sent tens of billions of dollars specifically for testing to CDC, to FDA, and we now need to see where that money is going to be used to get the numbers to where they need to go. And it's even worse in some states compared to California. So we're not out of the woods by any stretch. Next question is from Eric. Eric says the economic relief packages are needed and greatly appreciated. Nonetheless, is any thought being given to the long-term effect on the federal budget? National debt is at $25 trillion and climbing, which is not sustainable. Eric, I completely agree. I am deeply concerned that this year our deficit to GDP ratio is going to be around $3.7, $3.8 trillion, 20%, 18 to 20% deficit to GDP ratio. That's the highest that we've seen in many, many decades. The national debt, as I'm sure you've heard, is probably going to approach 28, 29, $30 trillion. Ultimately, we have a huge crisis on our hands right now with our economy potentially in shambles. And we've got to do what we need to do in the short term to intervene to ensure that our economy remains moving in a positive direction. And so we have these two competing priorities. Long term, I am absolutely concerned about our deficit, our debts. We're going to have a very, very strategic next few years as it pertains to our long-term revenue and our long-term spending. I've called for a new Simpson-Bowles commission or Simpson-Bowles style commission, since they're no longer in the House and Senate. But I think that's what we need, that sort of bipartisan, bicameral effort to figure out how we get the country back on solid financial footing. The last thing I'll say is that there are certain things that are costs, and then there are certain things that are investments. we've got to focus on investments. When I think about infrastructure as an example, the long-term economic benefit of infrastructure, whether it be on our broadband, our water, our electric grid, our transportation, putting millions of people back to work for those sorts of jobs, particularly when we just had 30 million people that filed for unemployment insurance in the last 6 weeks, that is vitally important. And yes, there's a price tag associated with infrastructure, but it's an investment in our long-term economic well-being, as opposed to certain things that are just costs. I'm not one that supports the payroll tax cut right now, as opposed to other stimulative measures that I think will do a better job. But we'll continue to have those discussions. Rhonda in Encinitas has a question for the doctor. Are people who have been previously vaccinated for pneumonia better protected from the virus or from more serious complications if they do contract the virus?
Unfortunately, no. The vaccination against pneumonia, I presume she's talking about the pneumococcal vaccine. There's a few different types of that, some that we give children, some that we give those that are at high risk, and some that we give those that are older. But all of them are against a particular bacteria, pneumococcal. And unfortunately, this is the virus, COVID virus, the novel coronavirus, so it is unique at this point. And some people who get sick with it may also have a secondary infection with the bacteria, such as pneumococcal bacteria. And so if you've been vaccinated against it, you might have a lower risk of that particular complication. But we know that people who are fully vaccinated with the vaccines we have out there and are otherwise healthy are still getting sick from COVID and are still dying from COVID. And until we get a vaccine specific to that, none of our other vaccines are really protecting us against it.
Thank you for that, doctor. Hayden has a question. He asks, I had a flu the first week of the pandemic, and because I was marked as an essential worker, I had to get a coronavirus test. At the time, the CDC, state of California, and my city all sent notices that it was free and directed me to the hospital. Now I'm being harassed for payment by the hospital, which is charging me more than $2,400 for the test. Wow. So I'm terribly sorry to hear about your situation, Hayden, and I would encourage you to continue to be in touch with my office to see if we can be helpful to you. I can tell you this is not supposed to happen. Under the relief legislation from a few weeks back, now over a month ago, actually, free testing was a key element of that. And so you should not be charged a dime. And if you're uninsured, you should be reimbursed through Medicaid or through the National Disaster Medical System. So I would recommend, again, contact our office and see if we can be of assistance to you. Any thoughts on this, Dr. Monadel?
Sure, just to provide a little insight into why that might be happening, not that it's the right thing to be happening, and I'm really sorry to hear this as well, Hayden. You were sick, and now to throw this on top of it can only be so trying. But early on, which it sounds like you were sick earlier on in this pandemic, we didn't have a lot of testing available for coronavirus. And so part of the workup was testing for a lot of other things, strep throat or for flu or for other bacteria or viruses. And so what I've heard from more than Hayden is that oftentimes those tests were not covered, even though they were part of the workup looking for a coronavirus, but in the absence of having a coronavirus test. Now that coronavirus testing is more available, not yet where we need it to be, but certainly much more available, we're much more often able to just go to testing exactly what we're looking for and skipping some of these other ancillary tests. Sometimes it is still appropriate, sometimes it's not. But that's still not an excuse for you to have received a big bill. Just to give you a little insight into why this might be happening. And in addition to working with the congressman's office, most hospitals have a patient advocate. And so if you've not been in touch with a patient advocate, I would encourage you to reach out to them as well.
Thank you, Doctor. Angel in San Juan Capistrano asks, my question is, will Democrats in the House be passing any of the following legislation? And then he's got a list. So I'll read the list. Hazard pay for frontline workers. Yes, I think we will. Money for states and cities. Yes. Election security. I hope so. I think so. More oversight on bailouts and big corporations. Yes. Food stamp money. I think so. Rent freeze and other payments. Probably yes. And more stimulus checks. Probably down the road. I think so. I share many of these priorities. I think, as I mentioned earlier, we've got to continue to deal with the pandemic from two fronts, from a public health front and from an economic front. And, we have done a lot in these four bills, but not nearly enough. And I would support additional funding for nutrition assistance. I think that we've got to do a lot more for emergency rental assistance. I support that. And in terms of oversight, the speaker did create a select committee that we voted on, and I wish it were a more bipartisan endeavor. But we did pass that the last time I was in Washington. Select Committee on the Coronavirus Crisis to oversee the funds that have been spent and are continuing to be spent. The committee is modeled after Harry Truman was when he was a senator. He chaired a committee overseeing funds for World War II, and that committee cost about $1 million to administer, but it saved the federal government about $15 billion in waste, fraud, and abuse from World War II. So the hope would be that we could do the same with this committee. Jim Clyburn, senior House member from South Carolina, is the chairman, and it's got a number of our members on the panel as well. Also, with regard to hazard pay, I absolutely would support that in the next legislation. There was a bill that Senator Schumer introduced, I think has a lot of momentum, to provide $25,000 for as a premium pay increase for essential workers. And I think that will be hopefully something that will be part of our next legislative package. And then I'm also a co-sponsor on Representative Blumenauer's bill with regard to election security, which would offer all registered voters across the country the ability to vote by mail. So you wouldn't be having to choose between voting and staying healthy, which is something that we never want to see again. So we're going to have to do everything we can to work with our colleagues to get these items passed. And, you've probably seen or heard the stories about some of the disconnects between Senate Majority Leader McConnell and some of his fellow Senate Republicans on certain aspects of this, and then the disconnect on things like infrastructure and certain other provisions between the president and Senator McConnell. So those things are going to have to be ironed out for us to be able to move forward on any of these items in a bipartisan manner to actually get them over the finish line, get them signed into law, and get those resources to people who need the most. Elaine in San Clemente asks, why did a group of surfers determine public health policy for all residents here by demanding and persuading the city council to open the beach during this pandemic? Why hasn't the medical and scientific community been consulted? I will start with a member of the medical and scientific community.
I'm sure it felt that way, Elaine. I'm sure it felt that way. But no, medical and scientific experts are most certainly involved in the decision-making that's happening around the reopening plans in every city and county. Media and social media are very unlikely to show the Zoom meetings that we're having on a hourly basis and the meetings that are happening at the leadership level. That just doesn't make for interesting photos, right? But protests certainly are something that is newsworthy, and we're going to see it all over social media. But that's not necessarily how those things were influenced. Now, that's not to say the government officials don't need to hear from the public and hear what their thoughts are. But at the same time, the scientists and the medical community is definitely weighing risks and benefits before they make any of these decisions.
Well, and I share the doctor's sentiment that I don't think the surfers determine the policy, but I think it's important that as policymakers that we are driven by data and by science and by the public health professionals and by the scientific data that's out there, as opposed to being driven by politics or being driven by a vocal group of surfers or anybody else. I think it's important that we do things for the right reasons from a public health perspective. And I certainly appreciate the different cities in our district working with the state, working with the counties to try to do things that are responsible, knowing that this is very difficult for everyone. Keeping businesses closed, keeping people at home, nobody wants that. We want to get back out to our normal lives as soon as we possibly can. We just want to do so in a safe and responsible way. And my great hope is that that's what people will do. Scott in Vista has a question. Has the approximate size of the COVID-19 virus been determined? If yes, what is it? This is really technical now. The specifications for the N95 filter note it will filter any particle larger than 0.1 micron. If the COVID-19 virus is smaller than 0.1 micron, the N95 filter will not effectively protect anyone wearing an N95 filter from inhaling the virus.
So the average diameter of the virus is believed to be between 120 and 125 nanometers, which is the equivalent of 0.12 or 0.125 microns, so is bigger than that 0.1 that Scott's mentioning there. So the N95s, if worn properly, should be protected.
Interesting. All right, that's good to hear. I don't have any N95 masks. I don't think my surgical masks will do the trick.
So surgical masks are really more intended to help prevent the spread from, like if I were sick and wearing the surgical mask, it helps reduce the likelihood that I'm going to spread it. The N95 is really intended for the medical workers that are doing really up-close procedures. So even I don't wear an N95 on a daily basis because I'm not doing, scopes down people's throats and things that are going to put me at high risk for those droplets to come my way.
Makes good sense.
And then medical community is using much more than the N95s, right? We're using face shields, we're using gowns, we're using gloves, and we certainly aren't expecting the public to walk around like that.
Very good. Paul in Oceanside asked, property crimes are on the rise, yet California law enforcement is forced to cite and release. As a retired federal law enforcement officer who served as the officer in charge of a large detention facility, I am aware of the stringent inspection process required of jails, and I believe they have enough resources to deal with pandemics. What can be done to better balance the current social distancing recommendations with the need for public safety during this crisis? First of all, thank you for your service in federal law enforcement. I certainly appreciate the really unprecedented challenge that our law enforcement community is facing. And it's a very tricky balance between public health on the one hand, public safety on the other. I think anybody that obviously is suspecting or suspected of committing a violent crime should be it shouldn't be released, should be cited, and we have to be very careful about this. I think the governor's office is trying to work with the California Department of Corrections to temporarily halt intake of inmates, and I think that's important. But at the end of the day, I trust our local and state officials to be responsible as they move forward with our corrections system, and again, that they balance public health and safety. And I've had conversations with both San Diego and Orange County law enforcement, continue to on a regular basis. I think by and large, they are striving to achieve that balance, and in most cases are achieving it fairly well. Linda in Vista asks, my concern is about closed churches. In church, I think we can all be trusted to safe distance, wear masks and gloves in this environment if asked to do so. What can you do to make the reopening of our churches happen? Well, that is up to state and local officials. I don't want to abdicate my responsibility as an elected official, but ultimately the jurisdiction for reopening churches will follow the public health guidance. The public health guidance will be determined by our state in conjunction with our counties and our cities. But I do think that like all other public venues, even with masks and gloves, there's going to have to be new social distancing put into place. Doctor, perhaps you want to speak to that.
Yeah, no, I absolutely agree with you. I would love for churches to be open again, as so many people would, but unfortunately, churches really involve a large number of people congregating in a small space with lots of things that people touch. And so that's really just a setup for a spread of a virus like this. I would love it also if we could trust everyone to wear their masks and gloves, but we've seen that that's not always going to happen. And, this is again, something that is a first of how do we make this happen in the future, but it will definitely look different churches will definitely probably need to put forth a plan for how they will keep their congregants safe, how they will up their disinfection methods and efforts, as well as practicing more social distancing. So they will reopen again, and likely it'll look different, and likely it'll be later in the reopening process.
It sounds like most things, right? They'll reopen, but they'll look a little bit different.
Yeah.
Bill in Vista asks, what discussions are underway with the administration to revise the SBA PPP rules to extend the period funds must be used from 8 weeks to 16 or 20 weeks? The reality is most businesses are still closed by shelter-in-place orders, and additional staff cannot be brought back until they are able to come back. Most businesses who have received SBA PPP loan funding will require additional time to hopefully get up and running. Bill, that is an excellent question, and that is something that we have asked as well. That is a very common challenge that we face with the PPP, among other problems. But the 8 weeks was set as a relatively arbitrary time limit back when the pandemic did not appear to be quite as bad, frankly. And when we passed that first tranche of funding as part of the original CARES Act, we thought that 8 weeks, we hoped that 8 weeks would be a sufficient period of time for the stay at home and the business closures, where we'd be past the worst of that. And we now see ourselves basically 8 weeks later now, where things are not back to normal, not even close to back to normal. So I think there is a dialogue, a discussion going on. I think it's something that has a great deal of bipartisan support to see that 8 week period extended. And whether we can retroactively extend it or not is something we're going to have to determine. I also think with regard to PPP that to the extent there's a third tranche of funds, we had $350 billion and $320 billion. To the extent there's a third tranche of funds, the focus will need to be on smaller mom and pop businesses. So the discussion has been, how do we help businesses of 25 people or less so that we make sure they get the money as opposed to the LA Lakers and Ruth's Chris Steakhouse and Potbelly Sandwiches and Shake Shack. And I like all those things, by the way. I'm not picking on any of those establishments or on the Lakers. Grew up a Lakers fan. But again, that's not where we intended for the money to go. Next question from Jeffrey in San Juan Capistrano. What is the Fed doing, or what is the federal government, I suppose, doing to help local restaurants and other small businesses versus the major chains? Well, if you're referring to the Federal Reserve, they have the Main Street Lending Program, and they're setting that up. And basically the way that would work is low interest loans supported by the Fed. And they would defer the principal and interest payments for a year. But we've been fighting to try to minimize, or to try to lower the minimum amount under that program, so that it would be accessible to the truly mom and pop businesses, to the people with one restaurant as opposed to the Shake Shacks and the Potbelly Sandwiches. But I think that between the PPP and the Fed lending facilities, we're really hoping that we can help our restaurants, because we know how dramatically they've been impacted by all of this. And, obviously, just the inability to have restaurants operating as normal is a huge blow to our local economy, particularly in a community like ours. It's so dependent on tourism, transit occupancy taxes, hotels, restaurants, amusement parks and things of that sort. All have been just devastated by this. So we're very cognizant of that. And that's also why it's important that we work with our friends to make sure that we have state and local government funding where we're able to do a recovery of revenue, not just recovery of direct COVID-related expenses, but also lost revenue. And I'm very proud of the fact that all of our mayors agree with us on that and have helped push that forward. And I'm very hopeful we'll get that done. Stephanie asks, very easy question for you, Doctor. When will our state open up? That's her question.
Super easy question, right? There will not be a specific date where everything just opens up. And certainly, as we've talked about, it won't look like it did before when things do start opening up. It'll be a stepwise fashion. There'll be transition periods. And you know already that it's going to look a little different from state to state. And very likely there'll be some differences even from county to county. The governor has Spoken earlier this week. I missed his press conference today. May have released some more details about some of the things he's hoping to open up starting as soon as this Friday. And so what that looks like, those restrictions, is the detail that we'll hear before Friday to help those businesses open in the most and the safest way possible to protect themselves and their employees as well as their customers. And as I've said, this pandemic is full of firsts. So, all of us are going to take these things in baby steps, because if we make giant steps as we're opening things back up, for sure we'll have some missteps.
Well, I know we have Mother's Day coming up, and, I think a lot of what I saw was opening up some businesses to be able to do curbside pickup, perhaps for some Mother's Day gifts. If Dr. Motordell's family is watching, no pressure. I got my wife and my mom flowers online, so hopefully, knock wood, they will be delivered on time. But if I hadn't done that, if we were going to wait until the day of, hopefully people can pick up those flowers or pick up that Mother's Day present curbside, thanks to the governor's order allowing that to move forward. Next question, Stephen in Vista asks, as an independently owned special event company located in Vista with a peak of 85 plus full-time employees, we are struggling to understand when we will be able to once again operate. We were blessed to receive enough PPP funding to bring 54 employees back for 8 weeks. That's good. But we are unable to actually generate any revenue. My question is, as the House and Senate explore future economic relief, is it reasonable to expect that you will recognize and respond to the fact that although we are all struggling with our businesses now, many businesses will be able to rebound much faster than others? I guess the short answer, Stephen, is yes, absolutely. I'm extremely sensitive to your situation. And, I think we also need to recognize the reality that once you are ready to reopen, that, you're not going to be able to repay these loans very quickly in some instances, depending on the business. So I think we definitely need longer term assistance. And, I think the Paycheck Protection Program, to the extent we designed it, was really as a stopgap. And we're going to have segments of the economy that I think will come back more quickly, and then others, such as your business, it could be quite a while before people are ready to have the kind of events that you're used to planning. So get in touch with our office, and we can work with you to see what programs may exist, and we'd be honored to try to help. Isabel in Rancho Santa Fe, she says, my question for Representative Levin is to ask what is being done to protect the health and families of essential workers from getting sick and suffering financial devastation if they do. Are you supporting Representative Khanna's attempt to establish a workers' bill of rights? Well, thank you for this question. Right at the beginning of this, I wrote Speaker Pelosi and Steny Hoyer, our House Majority Leader, a letter urging them to prioritize families and working people as we figured out the right response to all this. And as it relates to essential workers, I think it's critical we expand paid family and sick leave. We did some of that in the Families First Act, but I think we've got to go further than that. I co-sponsored Rosa DeLauro's Paid Sick Days for Public Health Emergencies Act that would require an additional 14 days of paid sick leave available immediately at the beginning of a public health emergency. And I'm also working hard to ensure that our essential workers have PPE. Absolutely unconscionable that they wouldn't, in a country with the resources that we have, that our frontline workers wouldn't have PPE is just absolutely nonsensical. So we're going to push very, very hard on FEMA and others to ensure that those billions and billions of dollars that we dedicated for PPE actually go to the people who need them the most. And let's see, Tom in Oceanside, that one for the doctor. What is being done to improve enforcement of face coverings at the federal level? Well, that's kind of for both of us. What innovative measures are being pursued to enforce the right kind of behaviors in face coverings? At the federal level, it's been a challenge to get my colleagues to wear even surgical masks, and we really need to do that. Obviously, as we try to get back to our business in the House of Representatives, we have to make sure that we're following the guidelines of our own Centers for Disease Control and Prevention, which include wearing masks and maintaining social distance. The challenge is that the work of the House of Representatives is all done in person and very much, you could have a meeting in the hallway or in the cloakroom, and it really is like the town square of American politics. And I do wonder as we go back how all that is going to change. It inevitably is going to change quite a bit. But anticipating that members of Congress will always stay 6 feet away from one another is going to be tricky. But I hope that we pull it off, because we need to get back as soon as we can and get the next bill done for the American people. Anything on the local level? How do we get people wearing masks?
Education, education, education. I mean, this is new for us to be wearing masks. Masks have become commonplace in other countries already prior to COVID. It certainly is not something that we were used to seeing here. If we ever saw somebody walking down the street with a mask on, we assumed they were sick. And now we're asking people to do it to protect those around them, not because they themselves are feeling sick. And this is something that's going to take time for everybody to really comprehend and get on board with. But I think everybody can do their part by not only wearing their masks and setting that example for those around them, but by educating those around them when they see somebody doesn't have it, not in an accusatory fashion, but sort of helping explain to them why it's important. I think the stores and businesses, as they open back up, will have a big role in this because they'll need to protect their folks, and that'll be important. And I think, we need to make sure that all of our leadership is setting that example as well. Celebrities, the people that are in the press, they need to be showing that, setting that as an example so that people can see it as commonplace.
Well, I was very pleased to see that Vice President Pence said that he should have worn a mask at the Mayo Clinic, but then I was not pleased to see the president visit a mask factory in Arizona yesterday and not wear a mask at the mask factory. Not great.
Missed opportunity. Yeah.
We'll work on it. Well, he's not going to listen to me, that's for sure. Maybe he'll listen to you. Guillermo in Solana Beach asks, my son was furloughed from his job as a physical therapist in La Jolla. Sorry to hear that. He says, after 2 patients and a staff member tested positive for coronavirus, how does he go about applying for unemployment benefits? Are these benefits automatic, or what federal or state agency does he have to contact? Well, first of all, I'm very sorry to hear about your son. It's a tough circumstance. I mentioned before, and I'll mention again, our website, mikelevin.house.gov. We've got all the links that he would need for the California Employment Development Department to sign right up, where they can fill out an application, very quick application. And I would recommend also, if your son has any further trouble with this, that he could reach out to EDD directly. They've dramatically expanded their call center hours. They used to have hours from like 9 a.m. to noon, and now they have, a lot more robust call center hours. But your son can also contact our office if he has any challenges with this at all. Jeff asks, in San Diego, golf courses are open, beaches are open, time to open tennis courts. Very easy to comply with social distancing. When will tennis be an allowed outdoor activity? That is an excellent question, and I hope very soon. I think it's a great point, and the next time I speak with my friends at the county level, I will ask that question. I don't specifically know the answer. Any thoughts? Maybe if it's singles, not doubles, right, Doctor?
Yeah,
doubles might be harder.
It's a great question. I hadn't thought of, prior. So I agree with you that could be something that could be looked at and may just not be on folks' radar right now.
Well, great question, and I'll try to follow up. Ron asks, why are so many small businesses not getting the promised money through the PPP program? It appears that the banks are the bottleneck. If the money is guaranteed by the Fed, then what is the problem? Well, so there have been a lot of problems. The first was we had our first allocation of money, $350 billion. It was gone very, very quickly, and too much of the money was snapped up by bigger small businesses. By that, I mean businesses of, say, 250 to 500 people. That's where we saw a number of public companies get funding. That's where we saw the Shake Shacks of the world and the LA Lakers of the world. And unfortunately, the small businesses, truly mom and pop, in many cases, were left out and got nothing. And I heard that again and again and again. That's also the case for nonprofits. Now, nonprofits were in a little bit of a different spot. You had some of the larger nonprofits, like the community clinic as an example, that didn't qualify because they were too big. And then you had some of the small nonprofits, like the truly, 2, 3, 4, 5 people, they didn't have pre-existing relationships with big banks or with existing SBA lenders, so they got left out. So in phase two, in the second tranche, the $320 billion that we passed a couple weeks ago, we tried to alleviate that by creating a separate fund of $60 billion for smaller lenders, with the belief that smaller businesses, mom and pop businesses, would utilize those funds. The good news is that that money ran out very quickly. The bad news is that there's obviously a demand for greater than $60 billion. So we need to go back and we need to allocate more funds. Whether we allocate more funds specifically based on the size of the business, or whether we do more for that specific size of the lender, remains to be seen. And there are other ideas about creating a grant program that would go directly to those companies with no expectation of repayment. And that's something that we're evaluating as well as we move forward on CARES 2. But great question. Lives in Oceanside asks, my daughter is getting married at the end of this summer. We have an appointment set in a couple weeks at a small local bridal shop. I'm having a hard time understanding why this business is closed, since there will only be the store owner and the two of us. However, I can go to the grocery stores where there is no social distancing. Any thoughts on the bridal shop?
Yeah, well, first of all, congratulations to your daughter.
Yeah.
But I'm sure this is not how you or she envisioned the wedding planning to go, and this has got to be very difficult in this once-in-a-lifetime event for yourselves. You are correct that the grocery stores are open and they are riskier than a small bridal shop maybe, but they are also considered essential. We have to eat, and so that's where we talk about weighing those risks and benefits. There's a big benefit to the public at large to have grocery stores open, even though we did see a lot of grocery store workers getting ill as a result before we really got good at the NPI or non-pharmaceutical interventions that have been put into place. So, people need the food to survive, and unfortunately, we don't need the wedding gowns. That is not considered essential. And even if it's just the store owner and yourself and your daughter in the store, you've now sort of broken what I like to consider your bubble. So you've now interacted with this store owner who may have interacted with someone, 10 minutes prior to you who had an infection, and now the store owner is carrying that virus on them. Or the dress that your daughter tries on may have been tried on by someone else prior and not been disinfected. Of course, not as easy to disinfect a wedding gown as it might be, the handle on the door walking into the store. So these are the things that, we're looking at to identify what is going to be needed so that bridal store owners can open their shops again. But at this point, the risk is greater than the benefit. Disinfecting
a wedding gown sounds like a bad strategy. I don't know how you'd probably wreck the wedding gown.
Yeah.
Well, congratulations to your daughter. And, obviously we hope that we get the business open sooner rather than later. And it really will follow the advice of the public health community and the city, working in coordination with the county and the state, following the state guidelines. Jean in Oceanside asks, testing and tracking are vital parts of getting back to normal. When will testing for all be available? What are the factors you're supporting to get us to that date? What is your plan for initiating tracking? Well, there's a lot of things that we have tried to do. We've sent a lot of money to HHS, to the FDA, to the CDC. I don't need to rehash from the beginning. There have been a lot of problems with testing in the United States and a lot of things that we've learned. I'd like to think that we could avoid some of these problems in the future. And we're going to have major reforms downstream. But in a nutshell, CDC had problems due to contamination with their original reagents and their original testing. And they precluded, along with the FDA, emergency use authorization for commercial and clinical labs to move forward with additional types of testing. So that's where we ran into trouble in January and February, where our per capita testing rate fell way behind most other countries. We've been playing catch up ever since, and we're still not where we need to be. And that Harvard model is 152 tests per 100,000 per day. And where we're at right now is probably at 30 or 40% of that across the country. So how do we get dramatically increased testing? Well, we need a plan, right? Again, failing to plan is planning to fail, right? So we demanded, as part of this last round of funds in the interim legislation that we passed a couple of weeks ago, that the administration develop a national testing strategy. And that would include both for the standard diagnostic testing and the antibody testing, and would have to be robust enough to get to that objective. And in California, we know that Governor Newsom has an objective of 60,000 to 80,000 tests per day for the state. We know that in San Diego and Orange counties, they're looking on the order of 5,000 tests per day, again, using that Harvard methodology. And I think in San Diego County, there's a pretty good path to get there. I'd like to think Orange County as well. But San Diego, between UCSD, the county, Scripps, Sharp, and others, I'd like to think we can get there. I know you're doing about 60 a day, isn't that right, Doctor?
We have the capacity to do about 60 a day. We're probably doing about 20 to 30 a day right now, but we're working that up quickly. And we were talking with the county just yesterday about ways that the community health centers can contribute to getting to that 5,000 tests a day goal that you're talking about. The county and the state both have task force specifically directed at testing and tracing or tracking. And so they're working on that plan that's needed and reaching out to those folks that can collaborate to make that happen.
With regard to contact tracing, we have a bill called the Unite Act that would basically use the existing structure of AmeriCorps and a lot of the volunteers that we already have through the AmeriCorps problem, and could train them. I'd like to see a lot of veterans trained as well to do this work. I think that would be a terrific opportunity. And I talked to VA Secretary Wilkie the other day about that, and I think there's a real possibility to move on that. So we're going to need a lot of testing. We're going to need a lot of tracing. Those are two of the T's. The third T is treatment, and then hopefully the vaccine coming as soon as possible. But very, very much front of mind for me. Yeah, Karen, go ahead.
Add, Congressman.
Please.
We also have to make sure we're doing the right tests. So, there's a lot of information out there that people are hearing about serology testing versus the other testing that we're doing. And the serology testing is not quite where we need it to be for it to be as reliable. And those tests are improving every day. And the test to look for active disease is improving every day, but they have to be done in the right manner. And so just because the test is being offered in your neighborhood, testing for all, has to be done in a methodical way.
Thank you for that. Karen asks, how are you working to ensure that the U.S. Postal Service will not be either privatized or eliminated? So we answered that a little bit before, Karen, but, again, this is critically important to me. And we've just received a ton of correspondence on this from constituents, probably over 1,000 letters and emails and phone calls. And we get all of those. And I'm very grateful to our community for weighing in. But it's clear that the USPS is so incredibly important to us. Everything from vital prescriptions that people get, and it's just a very important part of our economic fabric in the United States. And it also employs 650,000 people. I mentioned before, over 100,000 of whom are veterans. And there is I know a couple things. There's a bill from my friend Joe Neguse from Colorado that would provide $25 billion in immediate grants to make up for lost revenue during COVID-19. And I would support whatever we can do to put them on solid financial footing. And I'm also grateful to our postal workers who are also in their work really on the front lines of this too, along with our delivery drivers, grocery store workers, all those that are really making the economy go and making sure that we all have the services, the mail, the food. You really know who the important people are when you face a crisis of this magnitude. Gary asks for the doctor, could you please ask the doctor if the virus could possibly be totally knocked down by everyone adhering to a strict mask policy? If that is within the realm of possibility, how long would we have to hunker down to really make the virus die off, assuming we had 100% participation globally? Can masks alone solve the problem?
Unfortunately, no. Unfortunately, masks alone would not solve the problem. This virus is spread by droplets, and we talked about how masks can cut down on the spread, but It's not necessarily 100% protective. For one, we also know this virus is spread by fecal-oral methods as well. And as I mentioned, we're not totally convinced that it's not spread sometimes by an airborne process as well, because this virus is not going to just die off. Even if and when we develop a vaccine, the viruses don't, it's really not viruses that completely go away. Maybe smallpox we're there on, but polio is still lurking around places in the world. So we have to learn to cohabitate with the virus safely, and as opposed to just thinking about eliminating it completely, because that's not likely to happen. Hopefully there will be a vaccine that will help protect people, but we know that not everybody will get vaccinated for one reason or another, so there will always be that virus lurking around. We just have to make sure that it's at a manageable prevalence, that healthcare systems can keep up with it. We have to hope that we have some treatments that come out that will help take care of those that do get sick as well.
Well, thank you so much for that, Doctor. And in general, thank you for all the great work that you're doing. I'm truly grateful to Vista Community Clinic and all of our community health clinics across the district. And really, again, all of our hospitals, our doctors, our nurses, our frontline medical professionals, just for your incredibly important work. And we're going to do everything we can to fight for community health clinics in the next round of CARES funding, and specifically for Vista Community Clinic and all of your facilities in the 49th District. And I want to thank you again for joining us, and wanted to see if you had any concluding thoughts or remarks as we head into another week.
Just final comments would be to, really listen to the public health orders. Those are coming out for a reason, with specifications for a reason. And the more closely people can adhere to what is being said and the guidelines that are being put out, the faster things will continue to move forward. So wash your hands, wear your face covering, and follow the public health orders.
Well, thank you very much to everybody for tuning in, whether on Twitter, Facebook, YouTube. Again, I'd like to refer you to our website, mikelevin.house.gov, where you can see our resource guide with all the available links to the applicable federal programs. I want to encourage you to please reach out to our offices. If you have any questions or need any assistance with any of those programs, we're happy to help you. If we don't have jurisdiction or can't help you directly, we can certainly point you in the right direction to people who can. I want to thank our fantastic staff, our excellent Chief of Staff in Washington, D.C., Kara, our great Communications Director, Eric, and Francine and Kyle, and everybody at our district office, everyone on our legislative team, Jonathan and Faith and Robbie, everybody working so hard to ensure that we do all we can for our community to respond to this crisis. I want to thank our great videographer, Jeremy, for helping put together yet another successful live stream. And I really look forward to these every single week. I miss being out there in the community. I miss having our monthly face-to-face town hall meetings and all of our house parties and all the other community coffees that we do. I look forward to getting back to doing those as soon as we can in a safe manner. But I'm truly grateful that we've had the opportunity and will continue to, as long as this crisis is ongoing, to be able to communicate in this way. So just to echo the doctor's words, please follow the directive from the Centers for Disease Control and Prevention, from our state of California, from our counties of San Diego and Orange County, and from our cities. And we thank you for following those guidelines and for doing all we can. Also to just act during this time in a spirit of kindness and compassion for one another. I have a good friend, Louise Herbert, who has taken it upon herself to make over 4,000 masks, along with her group in South Orange County. Just one example of many regular, everyday people that are going above and beyond to help others in need during this crisis. So thank you for doing that. Thank you for just being great residents of the 49th. And until we see you next week, I hope everyone stays healthy, stays safe. Thanks again for watching.